Hello everyone. This class we will learn the contents of ischemic heart disease, especially for the contents of angina pectoris. I'm from the First Hospital of China Medical University. Part 1. Concept of ischemic heart disease. Ischemia refers to a lack of oxygen due to inadequate perfusion. And ischemic heart disease is a condition of diverse etiology, all having in common a disturbance of cardiac function due to an imbalance between oxygen supply and demand. The etiology of ischemia may be atherosclerosis, arterial thrombus, spasm, and so on. This picture shows the common cause of ischemic heart disease. We can find the narrow lumen. Part 2. Clinical presentations of ischemic heart disease. As we know, there are several types of ischemic heart disease, and we summarized into the following 5 types. The first one is the silent ischemia. The second one is angina pectoris, including stable and unstable, which is the major contents of this class. The third one is myocardial infarction, which is the major contents of the next class. The fourth is the sudden cardiac death, and the last one is ischemic cardiac myopathy. For angina pectoris, is a clinical syndrome due to inadequate oxygen for the myocardium, also associated with severe and transient myocardial ischemia, including stable and unstable angina pectoris. Unstable angina pectoris, including all sorts of angina except stable angina. And unstable angina describes a syndrome in which the patient's risk is intermediate between chronic stable angina and myocardial infarction. So it's a very dangerous situation. This table shows the different kinds of angina pectoris. We can find the stable ones and a series of unstable ones. Part 3. Pathogenesis of angina pectoris. There are several factors causing oxygen imbalance. For oxygen demand increase, there are exercise, emotion, heart failure, blood pressure increase, and increase of heart rate. For oxygen supply decrease, there are atherosclerosis, coronary spasm, and so on. This slide shows the pathogenesis of angina pectoris. Any factors contribute to the imbalance between myocardial oxygen supply and demand can cause angina pectoris. Part 4. Clinical manifestation of angina pectoris. For the clinical characteristics of angina pectoris, we can summarize it into 6 letters: O, P, Q, R, S, T. O means onset. The angina pectoris usually appear when excitement. P means position. It usually chest pain or substernal discomfort or even radiation to the arms or back. Q, quality. The patients usually feel heaviness, pressure sensation, squeezing, or tightness. R means remission. The chest pain can be relieved by rest or nitroglycerol. S, severity, usually slight to moderate. Time, usually for 1 to 5 minutes. Part 5. For the lab examination of angina pectoris, the ECG is the most common used and quite important one. So we pay attention to this part. First, routine ECG at rest. For the patient with angina pectoris, about 50% have normal ECG when at rest. But for some other patients, we may find the STT abnormality in the ECG, such as ECG depression and T-wave inverted. Second, ECG during angina attack. When the patient suffers from angina attack, then we may find the ECG change, especially the displacement of ST segment. For patients with subendocardial ischemia, we can find the ST segment depression more than 0.1 millivoltage by inversion of the T waves. For patients with viral angina, we may find the elevation of the ST segment. Third one is ECG stress testing. By this method, we can find the ischemic ST response is defined as flat or disloping depression of the ST segment of more than 0.1 millivoltage below the baseline and lasting longer than 2 minutes. The fourth one is 24-hour continuous ambulatory ECG. We also call it HORT. We can find the asymptomatic myocardial ischemia by this method. Part 6, the management of angina pectoris, also is the important part. The rule of management for angina pectoris, including the following 3 aspects. First one is relieve the symptoms. We can relieve the symptoms by improve the oxygen supply and by decrease the oxygen demand of the myocardium. The second one is the treatment of atherosclerosis. The third one is the treatment for reducing the risk of myocardial infarction and cardiac death in the future. This picture shows the consecutive treatment of angina pectoris, including the past, now, and future. The first aspect is the treatment for risk factors. All the factors that can cause the atherosclerosis must be modified, including cigarette, dyslipidemia, blood pressure, diabetes, and so on. Drug therapy for the symptoms, including nitrates, beta blocker, CCB. Nitrates can dilate the coronary artery, reading the preload and afterload of the heart. And the beta blocker mainly reduce the myocardial oxygen demands. And the CCB is the choice for right angina. Also was the secondary treatment when nitrates and the beta blocker are not effective. Drug therapy for myocardial infarction and cardiac death prevention. In this part, including 3 aspects. The first one is antiplatelet drugs, including aspirin and so on. The second one is lipid-lowering agent. The third one is ACEI. We much know that the first 2 key treatment is the treatment for atherosclerosis. Another therapy is revascularization, including PCI and CABG. And this method is indicated primarily to improve symptoms, but it also improves the prognosis, partially in patients with left main disease or left ventricular dysfunction with triple vessel disease. Part 7. The second prevention for coronary artery disease. In this part, we can summarize the contents into 5 letters, A, B, C, D, E. A means aspirin and ACEI. B means blood pressure and beta blocker. C means cigarette cessation and cholesterol control. D means diabetes treatment and diet regulation. E means education and exercise. Okay, that's all. Thank you very much for your attention.